So Dr. Parker, Aurora got a very special phone call from one of our amazing patients asking what the difference is between the Parker tummy tuck, signature tummy tuck, versus just your standard mommy makeover and tummy tuck.
All right, Aurora, gotta give you a good answer, okay? You ready? Well, let's see. Yeah, there are different varieties on a tummy tuck, but I'd say for starters, probably 90+% of the time when I'm doing a tummy tuck, I will do liposuction. We'll liposuction the entire abdomen. Not everybody does that, but that gives us more definition throughout the abdomen, thins out the fatty layer. And then secondly, we'll make a very low-lying incision. I make the incision just above the mons area and down just above the groin crease, so patients can wear revealing clothing after the fact. Through that incision, I'll lift up the skin then all the way to the breastbone. When I do that and the skin's lifted up, again, the vast majority of patients will tighten up the loose muscles that occur after pregnancy, weight changes. It's called diastasis recti, and those stitches are internal stitches that go from the breastbone to the pubic bone and create a strong muscle foundation. Mm-hmm. I'll inject those muscles then with a long-acting anesthetic to try to help minimize postoperative pain. I'll then go ahead and pull on the skin and remove the excess skin. Before I close the incision though, I'll do a couple of important things that again, not everybody does. I will thin out the mons area and lift the mons. We call it monsplasty. And so it rejuvenates the mons and it makes it look the way the patient was when they were, let's say, 18 years old. Yeah. I'll also thin out a little more what's called subscarpal fat in the abdomen, sculpting that area to try to get even better sculpture of the abdomen. I'll then close the incision with multiple layers of dissolvable stitches, offloading the tension on the incision to try to get the best scarring that we possibly can. When I do that, we'll put in what we call progressive tension stitches, and in most cases we can avoid a drain, not always, but most cases. So those progressive tension stitches can help us do that. Carefully close the incision, and then I'll make a little incision in the skin that now sits over the belly button. I brought that skin from top to bottom, and I slow down and I really make it my business to make a very pretty belly button. Mm. You know, patients will come in and they've been online and they see that some belly buttons are horrific, and that's not the case here. We really have very pretty belly buttons because it's a very detail-oriented procedure that I figured out how to make an any belly button, hide the scarring, and so it looks very natural. So I think those are probably the key hallmarks to a Parker tummy tuck. And then post-operatively, our patients enjoy our rapid recovery program, which allows them to bounce back pretty quickly from the surgery. We include 3 special type massages called manual lymphatic drainage massage to help chase out the swelling more quickly, and that's also very additive as far as a quicker recovery. And then beginning 3 weeks post-op, we have patients start putting some scar cream or scar tape on their incisions. And with that, in general, as you can see on our website, we get very nice scarring.
What would you say the scarring is, sort of in terms of what people can expect reality-wise of?
Yeah, scars are a combination of what the surgeon does and then what the patient does. And what I mean by that is that the surgeon, in my case me, I carefully close these incisions to create as little tension as possible on the incision, and then we use these adjunctive things afterwards like scar cream, scar tape to help us. As far as the patient goes, the patients are really kind of predetermined genetically. Some patients form thick scars, some patients form thinner scars. That we can't completely change. However, in my mind, as I close these incisions, I'm always thinking, well, what if this is a patient that's going to want to form a thick scar? I do everything I can to try to make the scarring as good as I possibly can.